What's up, everyone? You are tuned into the Fly High channel. I am your podcast poppy, Nate Fly High, and today we are discussing the Missouri Medical Marijuana Program. As some of you all know, I do have my medical marijuana card. There's a lot more to go into it. There's rules, there's regulations, caregivers, cultivators, a lot of things that are tied into it. Today I have with me Dawn from Educator Alternative, and she will be discussing exactly how to get these things done. She is an expert in her field. Hello, Dawn. Good morning.
I definitely appreciate the expert. Good morning.
I love it. So you say hi to everybody.
Hey, everybody. Hi.
And you can just explain a little bit about yourself and what you do, how you got into this.
Absolutely. So I'll start off with my handle on Instagram. It's Dawn the Cannabis Advocate, because I am a cannabis advocate. I'm a patient advocate. I've been in healthcare for about 16 years. Honestly, because my mother passed of breast cancer. Metastatic breast cancer was her second bout. And learning that I should have been able to offer her some type of alternative to resolution or comfort or ease of mind, I should have been able to offer that, aside from any personal or moral, religious holdbacks that she had, because I was raised as one of Jehovah's Witnesses, and that was not something that was an open conversation. So after losing her 16 years ago and having other friends that I helped them with their mother's transitions, and learning that there was a difference in taking cannabis in whatever form they did and taking it for myself as a patient, I learned that this is a plan I really want to support. I've worked in several different things, from the age of 10, because I come from two professional parents who did a lot, worked a lot of places that were very education driven. Being raised as a witness, I definitely know how to speak and present and knock on the door to, at about 5 years old, and present you with a wash, shower, and a wake. So, talking about this plant, honestly, is because it's my passion. I am a patient, card carrying, state of Missouri. Got my cultivating caregiver, where I'm able to get my medicine the way I need it for me. And my absolute blessing right now is that I'm able to be gainfully employed to do that. So I'm in office 5 days a week, but I'm never off the clock, because I have friends and family that need to transition on.
Right.
And the questions that we're going to talk about today, I talk about all day long.
All day long. Gotcha.
Random inboxes, in conversations, I'm at stores, I see people, I know folks, and it's always, because if I haven't seen you in about 10, 12 years, is you do what? You can do that? That's legal?
And it's a big conversation starter.
Yes, it's 100%. An awesome conversation starter. Just wearing certain, things in my comfort and on my off time that will spark a conversation of, well, how do you feel so bold as to wear that plant? Because I work for this plant.
Amen.
Mine as well. I get the chance to.
Amen. Let's spark some of this plant.
It's I'm St. Louis born and bred, born on Union, raised on Union and Wabata, grew up in the Greater Ville. All of my family's from St. Louis City. Both my parents graduated from Beaumont. My parents have known each other since they were 5, so I come from such a tight-knit community. To gaining access to a community that's building locally is a honor. Blessing. I'm humbled. So I definitely am floored, because saying I'm an expert. I'm not an expert. I'm not an expert, but I do try my best to stay up on everything. But when I don't know, I'll look it up, and if I don't know it immediately, I'll tell you, let me find out, or send you to who does know.
Great. I love it. So pass that to you. So one of the first things that I felt like I needed to get my card was my medical records. I went back and forth with a guy whose wife practice had closed, but luckily I was able to get some records from Christian Northeast, and I felt like they were the right kind of records. I was in a car accident, and that was in there, and the hernia records were in there as well. So I'm not too sure if you're reading this and he has these ailments that made it go faster, because it took me 6 days.
Okay, so when it comes to your medical records or anything you deal with in healthcare, there's a code, there's a price, there's an assignment of in your record. With that information, a doctor can really, and that's why it's there, so they can translate exactly the gravity of what you're dealing with.
Gotcha.
So those phrases and those terms and those different suffixes and things that translate to each doctor, and every time those records are gathered about you, that just gives a bigger picture about your chronic, long-standing condition.
Okay.
Now, you do have providers that will ask and require you to have something very immediate, very recent. But let's just be honest. Most patients are not compliant or see a doctor regularly because they self-medicate. They don't want to have to take the medications. They don't want to have to face the actual realization that they have a condition that's this grave or this serious, that they need to really treat properly and change lifestyle-wise. We all have lifestyle changes we need to do. So we usually don't go to the doctor to be able to avoid it. We all too busy. We're all too busy. So if this could be that opening into a new doctor, it should. Into a doctor that you can be honest about how you're self-medicating, so you can be legal medicating properly. Those medical records, even from the past medical accidents, chronic conditions that we don't talk about every day, but it's still in your record, that you need to let a doctor who can interpret that properly instead of worrying about, I don't know if I have. Ask.
Gotcha.
But unfortunately, most of us don't have a person to ask, and that's what we want to provide.
So do you actually need your medical records?
You should have them.
You should have them.
Specifically with Missouri's rules of their qualifying conditions, because one of them has to be diagnosed by a state licensed psychiatrist if it's a debilitating psychiatric disorder. If most healthcare locally, you're not going to get in front of a state licensed psychiatrist. You're going to see a psychologist, a therapist, a group. You're not going to maybe get that face-to-face time with a doctor to really get to the root of your mental health issues. Those folks are kind of in a limbo, but where our state's qualifying conditions kind of will carry that part is if your maybe primary care physician diagnosed you with depression, PTSD, generalized anxiety disorder, panic disorder, and the medications they prescribed you can cause physical or psychological dependence. That still qualifies you. You just need one qualifier.
Just need one.
You just need one for the application, but you should be communicating fully with any new doctor about everything you're wanting to treat it for. Right? Everything that you really want to use cannabis that you should be able to nourish your body with, you need to communicate that to your doctor properly.
So the doctor that I spoke to is he able to
certify? Yes. He is a medical doctor. State statutes allow for a doctor of osteopathy or a medical doctor, MD or DO, who is in good standing with the state Board of Healing Arts to certify patients. Now it's upon those physicians and who they are contracted with that's going to say or make or break if they're allowed to do it, which is why we provide a doctor that is independent of those rules and those confines.
Gotcha. Okay. So you need your medical records.
Yeah, you should.
Okay.
Now, seeing a doctor though, you're still establishing a relationship. You can still bring to him whatever is going on because he is a medical doctor. So you have medical doctors who can diagnose you.
Gotcha.
That's what they're there for.
Gotcha.
That last statement in the qualifying conditions was that it was any debilitating or chronic disorder or condition. Per the
you can grab the list of qualifying conditions that come on people to hear
absolutely
to know.
So the whole list. Hold on, let me get my coffee right. Pause. Because this is morning, I still have to have my coffee. Cancer, epilepsy, glaucoma, intractable migraines unresponsive to other treatments, a chronic medical condition that causes severe persistent pain or persistent muscle spasms, including but not limited to those associated with multiple sclerosis, seizures, Parkinson's disease, and Tourette syndrome, debilitating psychiatric disorders, including but not limited to post-traumatic stress disorder if diagnosed by a state licensed psychiatrist, HIV or AIDS, a chronic medical condition that is normally treated with a prescription medication that can lead to physical or psychological dependence when a physician determines that medical use of marijuana could be effective in treating that condition and will serve as a safer alternative to the prescription medication. Any terminal disease, or in the professional judgment of a physician, any other chronic, debilitating, or other medical condition, including but not limited to hepatitis C, ALS, or I'm not going to be able to say that today, IBS, Crohn's disease, Huntington's disease, autism, neuropathies, sickle cell anemia, agitations with Alzheimer's, cachexia and wasting syndrome. Anything, almost everything that is debilitating, something that could cause you to not be able to function daily in your life, is possibly treatable with this plant.
Gotcha. I agree with you. Okay. So any kind of medical record that you have with some kind of physical ailment you do need.
Right. So you can get that from a hospital. You had an injury, it was taken to the ER, at an urgent care, a clinic, a primary care physician, your OBGYN, your neurologist, your oncologist. Most people don't hear these things unless they've actually seen those.
And first I've ever heard.
All those little names. Oncology is cancer, nephrology is kidneys,
right.
Hematology is your blood. All those different conditions, all those different specialists that a lot of people have to see regularly need to be able to be a part of that care group to take care of that patient.
Gotcha. Okay. So as a card carrying member, that's how I feel. I'm a card carrying member of this great state of cannabis, allowing cannabis. What are the rules that I must follow? I know I'm riding with it.
You need to treat it as you would your weapon or any alcoholic container. You should not have it around where you can reach to it.
Gotcha.
Don't get in trouble. It's not worth it.
Gotcha.
I got my safe and I got, you put it away from you where you would your weapon. Okay. And that's to say you take it upon yourself to carry both. You have to be careful and be wise. This is still federally a Schedule I drug. So you're going to have to think, how do you move safely? How do you move safely? Do you do this? Do you do that? And everybody has to make their own decisions, but do it safely.
Right. So if I'm driving with it, should it be like in a glove compartment? Yes. Should I have it labeled with my name and my patient
name? You probably the strength, as much of that information that you would see on your prescription bottle. Okay. I would put on my bottle.
Okay. So just like prescription bottle.
Your name, your patient ID number. What type it is, have it in a sealed container, have it somewhere where it's lockable, because even when it's on your person, maybe from place to place, for personal consumption, you need to be able to keep your kids away from it.
Gotcha.
Treat it as you would your weapon or alcohol. It's not something that everyone needs to be just accessible to.
Gotcha. Totally understand. So, I know you can also grow your own medicine.
Yes.
Okay. So how does that work?
Okay. So you as a patient, if you decided when you signed up, when you got your card, that in your home you have a location you want to grow, you're able to grow with the permissions of however that works with your landlord or your own self as an owner, or owning your own property elsewhere. You would know where you're going to grow, how you're going to set that up, and the security precautions you're putting in place. And I always tell folks, put more than 2 in place. Put at least 2 in place. If it's going to be in a locked bedroom, lockable room in your home already. If it's going to be in the put some steps between that. You do have to allow access to the state when they want to come and check and inspect. We don't know when, but expect that it will happen.
Gotcha.
And just be clean.
And when they come inspect it, I need to have it.
You should have your placard posted. You should have your card and your spreadsheet that comes with that posted up in your conservation location. Get it laminated. Kinko's getting a little business right by now. If you ain't went and just got the little laminate sheets.
Gotcha.
I mean,
you need to have your plants labeled as well.
Yes, you should, because you want to treat this like your medicine. So you really need to be careful of how you're treating it and how you're taking care of it, and each one of its needs that you're meeting, so you can get the best out of it. I can't. It's so much fun to just be able to have your own medicine. You're not having to go about it in an illegal means.
I love it. Okay. Caregivers.
Okay, so a caregiver can get their card under a patient, either to just be their caregiver, access the dispensaries, go with them to the dispensaries and travel with it, and dispose of it for them. That's $25 to the state. $125 allows you to grow it. Growing it, you are able to grow the patient 6 plants in 3 different stages. But you're at a max amount that you can have in one place.
Gotcha.
So you do want to be careful if you as a patient are also growing for yourself, because you do have a max amount of, and I've got that detail from 18 plants in one location.
Right, so that's
18 flowering. Because you can have 6 seedlings, 6 non-flowering, 6 flowering.
Gotcha.
For one patient.
Understandable.
And it's really going to depend upon how you yield and really work with your plant and really make sure that you're being careful about how you medicate. I tell any patient going into cannabis therapy, journal how you're medicating so you figure out what works best for you. Right now it is a little trial and error, because you are having to either go about it in illicit means still and not know what strain and strength it is, or you're having to invest a lot of money in getting devices to try to figure it out yourself until you're able to really get a hold of your own and know what it is and can say for sure it is. Yeah, you want to be able to say, okay, this is how it works for me, so I can get this from the dispensary in the event that I can't get that at home, or if I can't cultivate anymore, or if my cultivator can't cultivate for me anymore. You still want to give yourself somewhere to be able to still know what you need for your, system.
Gotcha. And how much cannabis can I have?
From a dispensary, 4 ounces in a month.
Gotcha.
Now that is upon the patient certification as well, because at a certain point, patients can also go for dosage increases. They have to be seen by 2 physicians at that point, and the lower of those 2 physicians' recommendations is what the state will go with. So you have to make sure that if you are legitimately wanting to make sure that you have enough from the dispensary as a patient, period, or to be able to have that much, if that's what your allowance is, if that's what the state allows you to have, you want to have the documentation for that. Gotcha. Just kind of cover your tracks, because this is very new for Missouri. You have to still remain careful because it's federally still scheduled on a different situation.
Gotcha. And so I want to be a caregiver. Okay, you as a patient, my mom is a patient, my auntie is a patient. So I can grow 6 seedlings for you, moms, and auntie. And 6 for myself.
Correct.
Gotcha. So 6 seedlings, 6 in, I call it a vegetative state.
Right. 6 seedlings, 6 non-flowering, 6 flowering.
Gotcha. And that's for the whole crew.
For each individual.
Gotcha. Okay. All right. Just want to, just ask the question again so everybody can know exactly what you can do and how you can do it. So how are they going about being compensated? Is that's something that we have to work out together, or?
Yes.
Okay.
You and your caregiver will have to work out together, because you don't know that relationship, but you do want to be very honest and open about what is expected. Be it a family member, if you were working with a family member, if you have gotten consumer directed services, I would say that this is relationship to that if you know your worker. If this is a relative that's actually helping you and getting benefit from consumer directed services.
Gotcha.
Whomever you decide and deem authorized to be a caregiver for you and authorized to be responsible for that is being responsible for a number of things depending upon what you two agree to. They could be, expected to just do the bare minimum and just grow your medicine and you pay for every aspect. Or it could be a bartering system of goods and services, like I come and work time on my medicine, where you don't have to do it all the time type of thing.
Gotcha.
It really is going to run the spectrum upon the patient, what their abilities are and the caregiver's abilities. You're going to have more generous caregivers than others.
Okay.
It'd be very open, honest. Discuss your beginning, your middle, and your end. Always discuss your end. What happens in the event of you unforeseen occurrences befall us all? What happens if you get sick and you can't care for yourself nor my medicine?
Right.
How do we part ways, and who's responsible for what? Do I get any of this equipment and stuff back? Have those very frank and open conversations, so there's no question once that happens, you already have set that aside.
Right. Okay.
That's my recommendation. I don't know how other folks have set up contracts or anything like that, but that seems more than reasonable to me.
All right, I want to wrap it up with a couple more questions. I want to talk about the airports and the card.
Okay, so I wouldn't go to the airport with it. I wouldn't do it. I would wait until I got there. No, I wouldn't. Mm-mm.
Okay. What about the CCW in your card?
Okay, so as a CCW holder, you have the gun rights. You can have your firearms on prior to certification fully legal.
Okay.
Have a CCW and I want to get certified fully legal.
Okay.
Can I buy new guns? Yes and no. Private sales, trading, and gifting are still protected rights, but purchasing from retailers is a no-go as they require federal paperwork.
Okay. So they won't take your guns away.
No.
If you want to get a CCW, you can get one.
I believe so because I'm going to get mine.
Okay. And you can't go to the gun store and get a gun.
No, but you can be gifted and trade.
All right. So Christmas gifts all good.
Yeah.
All right. I love it. Okay. I appreciate you today. Oh, do one more thing for me. I want to tell everybody, I went to a certain place.
Yes, you did. You went to Educated Alternative and Primero Cannabis Clinics.
Okay. Where's that located at?
2317 Cherokee Street.
Okay.
Right at the intersection of Jefferson and Cherokee in the Antique Row.
Okay.
You see the sign right off 55 in Arsenal, right out in House of Bush.
Gotcha.
I'm there 5 days a week. The doctor's there several days a week. We offer telecare in the evenings for folks that can't get in the office during the week. But I'm there all day Saturdays, 10 to 4.
Okay.
But definitely just reach out to me. Dawn Cannabis Advocate, Educated Alternative, Primero Cannabis Clinics.
What's the phone number?
314-833-3303. Or you can text and call the travel line 888-253-6872.
Gotcha.
All right. Thank you.
All right, guys. I really appreciate you watching today. Like, comment, subscribe, and definitely share. Got some really good information from Don today. It's all about the Missouri Marijuana Program. I think everybody should, if it's culture to you, everybody should hop in and join in the fun. All right, guys.